Hey, this is Savannah, and this is my ACT video submission for skills validation, syringe and hypodermic needle use in pharmacology. When you're IDing lengths and gauges of needles, it can range from 20 gauge, which is the larger size, and then 25 gauge, which is the smaller size. It's also color coded, and 18 gauge is also another available needle size. Lengths can go from 5.5 inches to 1.5 inches, but can sometimes be 2 inches if needed. An example by this would be a 25 gauge needle by the length of 5/8 inches. When you're IDing common sizes of syringes, it's typically measured in cc's and mLs, which would be cubic centimeters and milliliters. When I'm describing injection sites, the top three are subcutaneous, intramuscular, and intravenous. When you're thinking of sub-Q, you want to remember it deposits beneath the skin, it slowly departs and spreads, and then it's more pain-free than the others, and the skin is flexible, pliable, so it's easy to work with when you're tenting, and it reduces the chance of injecting a blood vessel or something that's more important like a nerve. When doing intramuscular injections, also known as IM, you want to make sure you're placing the injection slightly into the muscle. Usually this is done around the thigh area, and whenever you're thinking of the difference between sub-Q and IM, it's got a greater blood supply than sub-Q does, and it's picked up into the circulation system and put into the blood flow quicker. Intravenous injection, also known as IV, is administered for quick action. Usually this is used during surgeries, so the doctors or techs or whoever's helping the assistants can have quicker access to the vein in case of an emergency. The drug medicine is often transported within seconds. Care must be taken very seriously when dealing with the vein. It requires the most skill and knowledge of the anatomy, so you are not puncturing the blood vessel or poking in the wrong spot, and this area in action can also produce a lot of pain compared to the others and lead bruising. When we're IDing different forms of medication, there's topical, oral, and injectable. Oral can be a liquid or solid pill, but injectable and topical is usually liquid. There's also controlled or over-the-counter medications, and when you're explaining application of topical medication, you want to make sure you're applying to the skin, eye, or ear. Superficial problems are usually only for treatment of topicals. Topical drugs include creams, ointments, and solutions. You want to make sure that the animal does not eat, lick off, and you want to make sure that you are always using personal protective equipment, and wash your hands. Always follow the label as far as it goes for treatment. If you're doing a general one, the doctor may have a different request due to playing in the factors of age, weight, or health. And you always want to make sure that you are using protective equipment for the animal. That way, if you do have an area that the animal can eat or lick off or bite or chew at, then you want to make sure that they are protected from the substance with whatever side effects it may have. Thanks.